Hi everyone, News Channel 5's Chris Conti here. We are talking about the Affordable Care Act and getting enrolled, which is currently happening right now. What is the deadline for people?
December 15, if you want your coverage effective January 1.
And what happens after the 15th if someone misses the deadline?
They can still come in and see us, but when they enroll after the 15th, their enrollment effective date won't be till February 1.
Okay, so is it constantly rolling though?
It is, but the actual deadline to when the door actually closes until next year in November, that deadline is January 31st.
January 31st. So really people need to get coverage by the end of January, this coming
absolutely.
January.
Yes, last chance.
That's the absolute last chance, so I have to wait till
unless
November.
They have a big life change, like they move, or
you get those special enrollment periods.
Yeah, for the most part, that's
for the most part that door closes.
Last train leaves January 31st.
What do you guys hear in terms of, I guess, questions or confusions? Like, what do people come in with and ask you about typically when they're?
Insurance is very confusing.
It is.
So I mean, there's questions about everything.
Everything. I don't understand.
Premium every month. Does the premium go towards the deductible? Does the deductible go towards the out-of-pocket maximum?
Right.
What's up with these co-pays?
Yeah.
What's co-insurance? I mean, is that percentage what I pay or what the insurance company pays?
Yeah.
I mean, it's a lot for everybody.
Range. Yeah.
And just, I guess, to be clear, in Tennessee, we handle all of this through the federal government. There are some states that have their own marketplaces. Kentucky had one for a while, and some different situations. But the way that they have decided to set it up here is to, I guess, basically outsource it to healthcare.gov, essentially. How, I know in the beginning, a couple years ago, there were a lot of bugs that first week when everything came online. Things were a little hairy there, but it's really been streamlined.
It really is good. I tell anybody from 4 years ago to now, it's like wonderful. I hardly have to wait to get an assister if I have to call the marketplace. I mean, we don't have to wait that long. It doesn't freeze up and doesn't kick you off like it did the first year. It's really good. I like it. And it's a lot of tools on there that are user-friendly. It's very user-friendly, the marketplace is.
What do people, or what should people know about in terms of, maybe losing Blue Cross and what does that mean for this? How has that changed things, losing a company or two in this marketplace for us this year?
A big thing to consider if your plan is being discontinued or if you're changing plans is to make sure that your doctors are going to be in network with your new plan. And the hospitals that if you have a particular hospital that you want to go to, very important to make sure that you're choosing a plan that has at least most of your existing providers still in network. And that's something that we as navigators help with a lot, is with the networks. And that's a good reason to find someone local to help you. Because if you I think the application is very user-friendly as on healthcare.gov. I think a lot of people can do the application by themselves. What they really want some help with and to talk things through with is choosing the plan.
Choosing the plan,
exactly.
Making certain my doctor is there, helping me navigate just how I'm going to get from this doctor, can I go to this hospital, or is this prescription going to be covered? That's really the bulk of the conversation, because the application is pretty easy.
Well, and even if you have health insurance not through healthcare.gov, a lot of that stuff can be confusing. I remember a couple years ago, I had a fall at my house and I had to get a couple stitches under my eyes. And I called the insurance company before I drove myself to the hospital, and I said, which hospital should I go to? I want to make sure I go to one that's in network.
Very smart.
So I go to the hospital that is in network. And then a couple months later, I get a separate bill, aside from the hospital bill, from the doctor's office, because the doctor wasn't in network. And so you just assume that asking the one question of, is my hospital in network, is enough, not that you have to ask when you sit down in the ER, hey, are you covered by my insurance plan? I mean, it's stuff people don't realize until after they have to deal with it.
That's true.
Unfortunately, that's imbalanced billing is I guess the term for that. And it is an unfortunate reality.
And really, people, I mean, it's a lesson in people have to be their own best advocate.
Absolutely.
Because if you're not looking out for yourself, there's not really anyone anyone who is in terms of this right now. And there's a lot of instances, I think, where people don't realize they can save themselves some money, or at least have things verified or triple checked. I mean, you know, a lot of times with hospital bills, I mean, also in this instance, I had a couple of overcharges for some very simple things that I was able to catch by just asking them to audit my bill and say, you know, hey, I don't think I should pay $300 for gauze. And so they kind of do an itemized, you know, audit of a bill. And so, you know, but if people aren't looking out for these things themselves and they're just kind of blindly paying things, or, you know, or what, then you don't really know what's going on sometimes.
You hit on the key this time. I think what's most important is staying in network. Yeah. That's going to be key this year, because you don't want to have to pay out-of-network fees if you pick, you know, the One Humana plan that does that, and the Cigna plans don't have out-of-network benefits. So you have got to be diligent about staying in network.
What, in terms of the plans that are offered through healthcare.gov, most of the major hospitals in Nashville covered, or does it vary depending on the plan, or how does that work?
TriStar, network of hospitals.
HCA TriStar hospitals are covered by both carriers. And then with Cigna, they also have the St. Thomas network of hospitals that are in network as well.
So it's a lot of hospitals, and a lot of clinics too. A lot of these places run smaller clinics and, you know, strip malls and other places.
Your urgent cares, you know, so you could go to those with, I know some of the Cigna plans.
Yeah. In terms of not getting signed up, say someone doesn't get signed up by December 31st, well, I guess
January 31st.
How about December 15th?
Okay.
Say someone doesn't get signed up by December 15th, are they going to be hit with tax penalties for this coming year, or when does that kind of start playing into things?
So you're talking about people that didn't have insurance for 2016?
Yeah, let's say I didn't have health insurance for 2016.
Yeah, for 3 consecutive months you didn't have health insurance, and you were above the poverty level limit, you should have gotten it.
And I did sign up by the 15th, then I will be hit for this coming tax season, or
it'll be so. It'll be when you pay taxes for 2017.
Okay.
So if you don't sign up right now and then you don't have coverage in 2017, you'll pay your penalty in 2018. So I think there's kind of a delayed reaction there, where, you know, maybe you didn't have insurance in 2016, you haven't paid your penalty for 2016 yet.
Right.
And then if you don't sign up for 2017 either, then you've got two penalties coming. There is a 3-month kind of grace period that Sharon touched on. So if you don't sign up by December 15th, so your plan doesn't start January 1st, but then, you know, January 31st you realize, okay, I really need to sign up for this. You're not going to be penalized, even though your coverage won't start until March 1st. January and February are kind of freebies. They give you a pass, so you won't be penalized at all as long as you do sign up by
And a reminder to folks too, if you don't have insurance, you know, and you're worried about getting penalized, there are other options besides that. You know, you could go directly to a healthcare cover or insurance company and buy a plan that way too.
Off the marketplace.
You know, there's other ways in terms, and then you wouldn't get hit either.
As long as it's an ACA compliant plan.
That's
so
exactly
some companies off the marketplace do sell plans that aren't ACA compliant. They don't meet the minimum value standards with the ACA, and you would still be liable for the penalty unless you had another type of exemption with those. But there are a lot of ACA compliant plans that are off the marketplace too. So,
what I guess what have been some of the worries with people? What have you guys been hearing just in terms of? Is it, you know, like that one caller we heard from talking about individual sections of this that they're worried about might go away, or people just in general worried that it might just disappear, you know, entirely? Do you hear more one than the other? I mean, people that are people more worried that it's going to disappear completely, or they're just worried it's going to change in ways that are going to affect them, I guess?
I think people have really enjoyed having their coverage, and they're just afraid they're not going to have it anymore. They don't want to go back to not having coverage, because they've had it and it's been wonderful, and they've been able to address issues that they hadn't been able to address before, and they're really getting healthy. And the thought of having to go back to a point in time where I can't get anything done and I'm going to get sick again, my health is going to start to decline again, that's a worry, I think, for people, that they're getting healthy and they like it. and they want to stay that way.
Do you know how many Tennesseans get healthcare coverage through the federal exchange? Estimate?
Yeah, last year about 268,000 signed up through the exchange.
Which is a pretty big number. I mean, when you think about people in the gap is about the same number of people, so that's and it's no small. That's not a small thing. So
there's also about 250,000 people that were newly eligible for TennCare and have signed up since the Affordable Care Act was enacted.
What about in terms of getting signed up? I mean, how long does the process typically take?
I always like to block off about an hour or an hour and a half to sit down, and I don't want people to feel rushed. I want to sit down and we get through the application easily. Sometimes the immigrant applications may take a little longer because we have more information to put in. But I would just carve out maybe an hour and a half to sit down with us.
To get coverage for a whole year?
That's
not a lot.
That's not too much. That's not too bad.
I mean, and people get scared of this stuff, and because it can be confusing, so it's kind of hard.
Yeah, we're really nice people. You get to really like us, and you come back year after year after year.
especially Sharon.
We are going to take a quick break, and we're going to wrap up coming up after this commercial. Stay with us.